on Cheers, TikTok Live number 39, November 15th, 2024. First question was just asked, and I am recording this I got the phone right here. I got the laptop right here. Recording this for the podcast. It's going to go out on YouTube, my YouTube channel. It's going to go out on podcast, long form content. Maybe we'll cut up into short form if there's anything good. Friday night, just hanging out. Girlfriend's super sick tonight, so wasn't able to come over. So here we are. It's all good. Get the Jessica Pittman, S. Hines Jr. joined. Kellywood Ray Max joined. What's up, friends? Cheers. Happy Friday. It's funny because as you come into, you get older, you start, work is like, Jesus, you can't get out of work anymore at all. Not anymore, but just ever. And I don't know. I'm a big happy Friday person. I just think that you come into Friday and you made it, right? You got nothing tomorrow, hopefully. You're off, hopefully. I'm on second call this weekend. Not too bad. Could be worse. In about 15 minutes. At 7:30, they put sushi at my grocery store spot, Fairway, in Kips Bay. They put 30% off, which is actually a pretty good discount for it. And it's really good sushi. Yeah, lame it may be, but that's kind of how I make a cute little night of it, right? All right, so first question. Let's get to it. Isaac Marshall, watch of the day, brother. Always got to ask. Well, the watch of the day that I wore today is actually over there. No, you can't see it. On my night table, that's my Jack Mason Halyard. That's been my OR day. Whenever I'm going to the OR for surgery, I wear that one because it's like it could get dinged up, like God forbid, but I'm taking it off or putting it on and I drop it, which happened over the summer with a watch I really care about. I love my Jack Mason Halyard, but it's like a wear and tear watch, it can take a beating. I wear this on my OR days. I wear the other one that's not. Anyway, that was watch of the day. That earned it. My God, did that earn it. We put closed reduction arch bars on the maxilla and the mandible to secure a patient's maxillary dental velar segmental fracture, as well as the same thing on the mandible. Reposition them and put some arch bars on to fixate them in place. And that we did a zygomatic arch reduction today. This bone from here to here, your cheekbone, the zygoma, extending backwards towards the ear. This bone right here is the zygomatic arch. Many times that'll get kicked in. That'll just get kicked in literally like this. You look on the x-ray. I can't show the x-ray, unfortunately, but it'll get kicked in like this. And there are two ways to approach this. You have the Gillies approach from behind this. You shave the hair right over in this area, make a little incision. You extend an instrument we call an elevator. You dissect down with maybe a mosquito or whatnot. You use it's like a big mosquito. You get underneath this bone, the zygomatic arch. And then you use either a row elevator or a Gillies elevator, and essentially what you get a little instrument out there and kick it out, okay? That's the Gillies approach. That's what we did today. Right over here, incision and close it up. You got to be very careful. There's an artery. It's called the superficial temporal artery. It runs up in this direction. If you hit that, you could literally, the blood would literally shoot across the room. That's how strong it is. And we did not hit that today. There are arterioles in the area, of course. But anyway, you want to dissect in a certain plane where there's no nerves or arteries. Okay, so that being said, the other way is the Keen approach. That's intraorally. You go up in the vestibule. I've never done this approach. I've been a part of and have done the Gillies approach several times up until this point in residency. And it's good. It's simple. It's a quick case. It's really not that long if you do it correctly and, precisely. But the Keen approach, you could do the same thing from intraoral. All right. Anyway, let's get back to the basics here. Let's get back to the live Isaac Marshall watch of the day. So that's the watch of the day. I changed this because I was having a couple of beers. We stopped by the Gem Saloon. So shout out to Gem Saloon. We stopped by there on the way out after this hectic week. My God, it was a very busy week. Today itself was busy up until like 2 o'clock. We had to do the arch bars in the clinic because a number of circumstances, unfortunately. We didn't want to. It was the only way it could get done in a timely manner and appropriately, right? We needed to get it done. Okay, so let's move on. Top 3 listeners, guys. TikTok live number 39. Top 3 listeners that stay on the longest of this chat, I'm going to give you guys a shout out in the podcast caption on YouTube and podcast. So you'll be in the caption if you want to see it. All right, so top 3 listeners. Whoa, I missed a lot of comments here. Man, Jambro PY7CP. Maybe this blows up and you don't have to pull teeth for 20 years. What? Maybe. That's funny, but maybe what blows up? You're talking about the TikTok live. Maybe. I mean, I would still not pull teeth. I really like doing oral surgery. I actually do. It would be pretty sweet. I don't want to do that. I don't want to have to need to do that for money. You know what I mean? I want to do surgery because I really do like doing surgery and helping people. I've been told I got good hands. I want to do that to help. But TikTok, I also find that it's helping people, right? Honestly, it's at a much larger number than oral surgery, which is an interesting concept to think about. You know what I mean? Like I sign on to a TikTok live for 30 minutes or an hour, however long you guys want to go, and that connects with more people than I could possibly do in a day of oral surgery. Interesting, right? Here's 76. How do you have so much energy? Are you not tired? Cheers to that. I am exhausted, dude. I am exhausted. Dude, today I literally almost fell asleep in the chair in the middle of clinic at like noon. It was noon, and I went in about 6:50 today, 6:45, 6:50. Got in, yeah, right around there. It was a good day. It was a lot. We did 4 cases by noon. I mostly did 2 of them. It was the zygomatic arch reduction and the closed reduction of the maxillomandible for the segmental dental alveolar fractures in the anterior portion of the jaws, and in clinic too. So under local, and it's like we preferred to do that in the OR, but again, circumstances permitted. Only clinic. Anyway, all right, so let's keep going. How do I have so much energy is what the question was. I don't know. I enjoy this. We're having fun, right? Anna join. What's up? T. Stanley join. Willa, Ronkin, Hertwig's epithelial root sheath is the MVP. All right. Zana BS17, have my DAT tomorrow. Pray for me. All right. Let's say a quick little prayer for Zana's BS17. I don't know the whole Hail Mary prayer in Spanish, but that's as far as I know. So, Zana, that has to do. I'm wishing you the best of luck. You'll do fine. You'll be fine. Get a good night's sleep tonight, though, and have the same amount of coffee. Don't go overboard, maybe a little bit extra, but have the same amount of coffee that you usually have when you study. Okay, that's my recommendation. Trust me. I used to do 2 espresso shots before going into the CBSE exam. And then it's, what is it, like 200 questions to 4. Yeah, it's like 200 questions. So at halftime at 100 questions, you get like a little, it's not like a lunch break, but like a halftime break. I used to have the other 2 shots of espresso. And now you have to be careful. You don't want to have too much caffeine because then you got to pee. You don't want to have too little caffeine because then you're not in it. You need to be in it. You need to be hyper-focused the entire time. So 2 shots before I went into the CBSE. And then at halftime, I took another 2 shots of espresso. And it worked. It worked for me, I guess. Mindless Running says, my red light therapy cause me cavities? 95713. Is that TMJ as well if cheek hurts where you were pointing? Yeah, so the TMJ is right here. TMJ stands for temporomandibular joint. Yeah, it is quite common. Many people have pain in there. My TMJs, they click and they pop and they're really annoying. Sometimes they do hurt. I think I grind a lot in my teeth in the middle of the night too. T. Stanley joined the live. Awesome. Like the live. Awesome. Thank you. And this is the TMJ area. Just where you were asking about, that's the TMJ area. So if you have pain, yeah, I mean, you could always get a consultation with an oral maxillofacial surgeon. JV, we need you to cosplay Garfield. I don't know what that means, but I don't know. Is that like because my mustache is going in? I'm doing the No Shave November. Someone just told me I've been doing this. We're 15 days in. It's November 15th, 2024. And someone just told me last night that the Movember, like the No Shave November, is awareness for prostate cancer. And I'm embarrassed to admit I did not know that. I'm so glad that they told me. Is that true, by the way? Is it for prostate cancer? I'd really like to know. My dad was just diagnosed back in earlier this year with prostate cancer. So I was like, wait, I'll totally do this. So, I mean, if you have any ideas, I don't know how to like raise money or whatnot, but dude, I would totally love to raise money for prostate cancer if that's a possible. And then I could also say like growing out the mustache for prostate awareness. You have a problem with that? Just joking around. All right. Sorry, I just got the primary person on call will text you, call you if something came in. This was just giving feedback, closing loop feedback, which I am a big believer in is communication in the hospital setting. It's so important when it's so important to have closed loop communication, meaning that whenever something is like asked for a response or insinuated that a response should be given respectfully, that's actually a big point because you want to always respond to someone who's requesting it, right? Especially in a hospital setting, there are patients involved. You gotta let your colleague, someone who's on your team, your staff, your doctor, your whatever, you got to have closed loop communication. It's so important because that's where the majority of mistakes are made. There is not closed loop communication. And some people just think that other people assume things like, oh, well, I thought you knew that. Never assume that. Never do that. And I had a talk with the team earlier this week on Monday, and I don't think it was actually the majority. Let me be fair. The majority of the team was receptive to it and made the changes, but not everyone. From apparently, okay, user. Here we go. Here's 76 tips for OAC, like an oral anal communication. Is it just hard to avoid when extracting for some teeth? Well, an OAC is an oral anal communication that has to do with the maxillary sinus. It's right above the maxillary teeth, not the mandibular teeth. The mandibular teeth are right above the inferior alveolar nerve. That's what you have to be careful of the lower teeth. The upper teeth, the posteriors, are right near the roots. The apices of the roots are near the maxillary sinus on both sides. That's where the OAC happens. So I'm very careful using tactile sensation when I take out, especially just yesterday, one of the last cases we did yesterday, taking out a maxillary left posterior molar. Just be very careful with taking out that tooth. And then check. You could always check at the end. You could do the Valsalva maneuver gently. You don't want to make an OAC from what you. A Valsalva maneuver is when you hold your nose and mouth, and then you try and push out air essentially, and that force causes an increase of pressure in your airway as well as in your sinuses, right? And if there is an OAC, you might see some air come out of the extraction socket where the tooth came out. If there's an OAC, the oral anal communication, the hole into the sinus. All right, let's move on. BIOS creations. Need my wisdom tooth taken out. I'll make an appointment with you. Please don't let me wait months. Well, you can, but I'm in residency right now. I think you want to wait out until I finish. I graduate, and then I'll be in Melville at All County Oral Surgery. I'll be at the Melville office starting August 15th. So you let me know. We do it then. How does that sound? Addison Miller, what do you think about scaling assistance? What does that mean? Scaling assistant? What's a scaling assistant? I'm not familiar with that terminology. Running wild, 4-3-2-1. Plans after fellowship. Well, this is my plan. I'm not going to do a fellowship. I definitely do not want to do a fellowship. Dude, then I know someone doing a fellowship in cosmetics. So, like, an oral surgeon it was like a plastics fellowship, and they did, like, BBLs, facelifts, breast implants. Yeah, oral surgeons can do a fellowship and do that. And I'm pretty sure, maybe this isn't true. I haven't confirmed it, but I heard that surgeon who did that is now doing Clear Choice. Clear Choice is like a very quick profiting organization. It's owned by Dental, which is a DSO. It's a corporation. And Clear Choice is when they do all on X's. The oral surgeon comes in 2, 3, 4 times a week, maybe 1 time a week. They come in, they do 2 to 3 all arch implant cases. They never saw the patient for. They just come in, they do the surgery, and they leave. They're given all the information about the patient, assuming it's true by whoever planned it up. And I don't know. It's kind of like a drive-through surgery. That's how I would relate. If someone's in it, please let me know. Like, hit me up. DM me, Instagram, LinkedIn, text me, call me, whatever you got to do. Email me if you have that. But I would love to discuss this further because it's kind of like the drive-through of dentistry where you get a whole new vehicle. It's extremely expensive. It's like $30,000 an arch. But like $30,000 for the top jaw, $30,000 for the bottom jaw. Or it might be less. It might be less, right? It might be 15, 20. I think it's more than that, though. And then you leave with teeth in a day. You get all your bad teeth taken out. You get the new dentures locked on these implants that are put in, and you walk out with teeth. But, point being said, I'm not doing a fellowship because I know people that did fellowships, and they're just doing the same thing that I would be doing without the fellowship. That's my point. You get it? I don't know. And that's a really good metaphor for all of healthcare these days, actually. You can ask me more questions about that. I want to move on. Ceramic bow. Almost done with training. If not, good luck. Almost. I got like 6-7 months left, and then we're good. T. Stanley 22. How often do you work with PROS residents for implant placement? We have the VA, we have the city hospital, we have the private hospital, and we have the dental school. We work very closely with prosthodontists at the VA. And we don't work very closely with prosthodontists at any other facility. So the VA, and the VA is my favorite rotation. I like working closely with other dentists, other dental specialists. It's a lot of fun. I really enjoy that. BIOS Creations, follow the live creator. Oh, thanks, BIOS Creations. Mark McGuire, D3, ranked number 1. Can't decide if I would like endo or OMS more. Okay. Well, Mark McGuire, congrats. Being ranked number 1 in your D3, you've been doing this for 3 years. Or 2.5, I guess, at this point, right? Congratulations on that. That's very difficult. That's an extreme challenge. You're killing it right now, honestly. Or OMS, great specialties, but they are vastly different, right? The business side of it, so they say, I don't know, I'm not in that part of it yet. They say it's very similar. The dentistry part of it, endo, is doing root canals. Some of them do apicoectomies, and some are doing implants now. But oral surgery is all the big surgical procedures of dentistry, my recommendation would be get in there, see what it's like, get exposed to both of them. And really think about that. It's very important. You want to make sure that you've been exposed. Like, spend a certain number of days in a row at both of them, or like at one and then at the other. After the 5th day or after the 10th day, for example, you should know at that point what you're most excited to do the next day, right? That's going to be the best way to kind of gauge what you're excited about doing, what you like doing, what you would be excited to do during a 4-6 year residency, working 100 plus hours a week, getting paid nothing, like literally next to nothing. And you'll see this. This is very important. It's that's my recommendation, Mark. Let me know what you think about that, if that makes sense. Michael, how do you work up to your sub 8-minute pace? I post my runs. I run 3 times a week. I would stick to that. If you really want to get good at running, I would run 4 to 5 times a week consistently if you really wanted to get there, up until you get there. Does that make sense? I would also change up your runs. Don't run the same distance every week. Sometimes run with hills. Sometimes run longer distance flat. Sometimes run longer distance with hills. Sometimes run shorter distance, 1.5 miles with hills. Sometimes run 1.5 miles, like really get after it. Really try and push your time. So by changing it up, you kind of confuse your body and your body adapts, and then you get better times. You get faster. You get in better shape, more endurance. Renee J68 just got the #1 gifter badge. Thanks, Renee. Thank you. Brooklyn Williams, Owen Hunt. Did Owen Hunt have a mustache? I'm trying to grow this out for November. This is like my no shave November attempt of just the stash, a little Movember action. J68, I want your energy and motivation. Start your own podcast. Do the TikTok lives. Start your own podcast. Record it. I'm recording it right now. Top 3 listeners, by the way, who listen the longest. I'm gonna give you guys a shout out in the caption of the podcast on YouTube and Spotify, Apple Music, etc. User 3274, tips on someone applying to dental school with a 3.6 GPA, 19 academic average, and 23 perceptual abilities. That's how you said PA. Make sure you apply to a lot of schools and think about your shadowing hours. Think about your exposure to and time observing different dentists. You know what I mean? Obi Florence 77. I'm a CDA. What's the best specific practice to get into as an assistant? That's a great question. I don't know the answer to that. I would assume oral surgery, but that might just be a biased answer. Basing that solely on finances, like earnings, that might not necessarily be true. I think you just got to shop around. You got to see who's got the best price, right? Who's going to pay the best salary? Who's going to appreciate that the most, you know? My goal is to one day to appreciate my team the most, and I want them to be living their dream. You know what I mean? Renee J6, I am hearing and reading more about the dangers of a root canal and what it can do to the body. Not that much from my understanding, from my learning, from my training, from my experience. What it can do to the body, a root canal? There was that Netflix show, right? A lot of that's propaganda. I don't know why that was released. It should have been cleared by a number of dentists, not just one dentist submitted to Netflix and then they post it. It's a professional video and it would affect a lot of people's professions, and it might, who knows if it's a form of misinformation or not, but I would take 100 dentists, right, and see what they think if that video should be released or recorded or produced, and then get your answer. Who knows? T Perch, did you do research during dental school? Yes, I did. I did research on peri-implantitis, the use of lasers for like kind of like a laser focused scaling root planing. Yeah, and that's what I did research on. It was actually with a periodontist, even though I went to oral surgery, and he wrote a letter of recommendation. So if you are applying to oral surgery, by the way, I tried it out. They all said, don't do this. But my mentor, and I love the guy, it's Dr. Georges Romanos at Stony Brook. I went to Stony Brook Dental School. If you know him, say hello to him for me, by the way. And yeah, I did research with him in dental school. He was one of my closest mentor teachers in dental school. And yeah, he wrote a letter of recommendation for me for oral surgery residency. And yeah, okay. And how important is research for residency? So to give you an example, about 2 to 3 programs asked me about my research that I did during dental school. 8 or 9 of them asked me about playing the violin. I played the violin growing up. That's one of my instruments that I learned. That was my main, and I enjoyed playing it. I still enjoy playing it. I got it right up there, actually, in the closet. But I played it a couple months ago. And 8 attendings asked me about that on my interviews. So I would base that kind of how important that is, especially for applying for 4-year oral surgery spots. Loganbro, is there ever any complications with anesthesia? Is there ever? Well, wait, which anesthesia are you asking about? Is it local anesthesia? Is it sedations? Is it general anesthesia? I mean, there's complications with anything. With local anesthesia, I'm not going to get into it. Yes, there are complications with anesthesia. I'm considering that you're asking about IV sedation, and yeah, like you're still breathing on your own, but your airway can be compromised at any moment if your body is a lightweight, quote unquote, and reacts very loosely to the medications, or if you're, general anesthesia is another thing. But local anesthesia, say the provider doesn't realize that they inject it right into an arterial or a vein or something, it goes to the heart, and it goes to tachycardia, increased blood pressure, a number of things. There's also the epinephrine syndrome, quote unquote. All right, Renee J6, I think you're just fine. Make sure your general dentist keeps an eye on that root canal that was done, right? Tyler R, does sensitivity toothpaste really work? Yes and no. Many times it does. It clogs the dental tubules, so supposedly around your teeth in the dentin and cementum. Many people say that it works. Melly, when should one start studying for the DAT in undergrad? Maybe third year, second year. I would shadow through first and second year. If you like it, start studying for that third year. I started studying for that fourth year. I took a gap year, and I took the test right about a month and a half after I graduated undergrad. You could do that. It's doable. Indian Outlaw 01, follow live creator. Thank you. Do people, this is mean face and lovey face emojis person. Do people usually get into dental school on their first round of applications, or is it usually 2 to 3? That's a great question. I don't know. I mean, I would hope within 2 to 3, but obviously not everyone gets into dental school. I got into my first round. Vincent, biggest threat to OMFS? Great question. The biggest threat you could, there's a lot of things going on. Wow, a lot of people ask questions. Oh my goodness. I'm trying to go back and find where we were. Holy smokes, I gotta move. Vincent, biggest threat to OMFS? Biggest threat could be like the threat that they might take away oral surgeons doing sedations. I don't think that'll ever happen. Biggest thing I would say would be implant dentistry. At the dental schools, most dental schools, they only send their implants to periodontics now. That's not good. Implants are generally the best ROI. From an oral surgery standpoint, they're a really easy procedure. They're really easy. But it's funny because you put a couple implants in, they're starting to get covered by insurance, but they're generally not. It does require a lot of skill and precision. The OMFS, from my standpoint, personally, I think an oral surgeon is capable, qualified, and the best person to do this invasive surgical procedure. But dental schools, for a political reason, generally, all the implants go to periodontics. And, if something goes wrong, where does that patient go to? Well, they go to the oral surgeon and or the emergency department at a hospital to manage that. That's not, so we end up taking care of them anyway. They should probably just go to the right place in the first, initially. Anyway, yeah, so that's just some insight to that. But biggest threat, it's one of those two. Dro Mandani, what is the treatment for trigeminal neuralgia? Well, I would visit an oral facial pain and medicine specialist, and there's a couple things. There's medication for it, and they could give you more insight to what treatment would be for that. But there's medication for it. Trigeminal neuralgia is very rarely a surgical procedure, rare to almost maybe even none. But you just need to be aware that medication would be, and you need to get referred to the right specialist for that. Does that make sense? Indian Outlaw 01 has surgery 2 months ago for, I guess you're saying had surgery 2 months ago for tooth removal. Still have swelling, but no infection. Awesome. That's great. Brandon's wife, heart face, at Tromandini, Comfort Meds, as someone who has had it for 8 years. Well, there you go, dude. Bosh, do you feel like the ED consults you for things they can address themselves, especially when you're on call? So generally get most of our consults from a level 1 trauma hospital right here in Manhattan. And we're actually blessed because most of our ED docs are outstanding. I know some of them personally, and they are absolutely outstanding. And therefore, they do the things they can do on their own. Like 95% of them. There's always that random ED attending who's pushing stuff to the specialist a little more than other attendings. But that's also fair because everyone has a certain level of comfort. You know what I'm saying? And you need to do the right thing. So it's fair. It's fair to say. But like a 2-centimeter laceration at level 1 trauma hospital, you don't need to call facial trauma for that. The ED can do that. And most times at our level, they do. You know what I mean? Very rare, although it does happen. I've had it dozens of times, but the majority of the times, the lacerations that I was called in for, or am called in for, it's literally like from here to here, or like from here to here, or an avulsion injury from here to here. It's like, yeah. So, T-Perch, follow the live creator. Thank you. Thanks, friend. Renee J did the emoji here. Bella knowing what you know now, would you go back and re-choose this career field? Thanks. No, I would not. I would pick something else. To be completely honest, I don't want to go into it too much. I wouldn't. Healthcare, to try and say it loosely, unfortunately, healthcare, I got into it because I thought, and it's kind of supposed to be a patient-centered career, which is awesome because it's about other people. It's like, it's helping them. It's making their lives better. They're hurt, they're sick, they're whatever. Let's make it better. And then you get into it and you realize that it's really an insurance-centered field. And so it's about the patients, but everything you do requires insurance approval in many cases on the medical side. In the dental side, yes, or it requires a certain fee because, and that fee is so poorly understood because technology prices have gone like this. Dental school fees have gone like this. The insurance rate has actually gone like this, technically, right? As inflation goes up, technology costs go up. But insurance doesn't reimburse things, and it's gone like this. So technically, from that standpoint, solely financial, not to make money, but the quality of life. This is the whole point, right? You should probably want someone who's well rested and whatever if they're like taking out your cancer. But all right, that's a heated subject, right? But it should be for anyone, I feel like, right? If you or your loved one has cancer, you would probably want that surgeon to be well rested, and like that's the only thing they have to focus on that entire day, right? But it doesn't work that way, unfortunately, because it's now insurance-centered care. Insurance doesn't reimburse literally like anything these days. And all the surgeons are tired and overworked and burned out and underpaid and overworked, regardless of what you think. Like, oh my God, a surgeon has such a great salary. The fact is like, compared to what it would have been if it followed the just inflation, not like patients having to pay more, but just literally based on inflation or technology, not even technology costs, it would be significantly higher than what it is today. And therefore, the surgeon, the doctor, the dentist, even lawyers too, they have a different quality of life than what it would have been if the trend followed what it was in the past. And look, it's not about like getting rich. It's not about that. It's about having the best quality of life because you want that patient to succeed. You want to have a success. You don't want it to fail. Anyway, let's move on. Bella, we just did that. Sigma, what drug should be prescribed in post-op swelling of wisdom tooth surgery? So I don't want to make any recommendations. I don't want to give any medical advice. Only opinion, but swelling is inflammation, right? An anti-inflammatory is, for example, I'm not prescribing this or recommending this in any way, shape, or form. Motrin, ibuprofen, right? That's an anti-inflammatory. It's an NSAID and can be prescribed for patients who are not allergic to NSAIDs. Anti-inflammatory. So therefore, that would combat inflammation or swelling, right? Tylenol is not an anti-inflammatory. It's solely it's an analgesic medication. So for pain, only for pain, and therefore that would not be something you could take for swelling. So ibuprofen would be an example of medication you could take to combat swelling post-op wisdom tooth removal. Grays in station 19. Follow the live creator. Thank you. Minerva, follow the live creator. Oh, thanks. No way you. Can I get DJS only for cosmetic reasons? Double jaw surgery. That's what DJS stands for. I have a recessed upper jaw. Okay. Can my orthodontist, but it's not medically necessary? I don't know. Can you get it for cosmetic reasons? Yes. But from my understanding, insurance companies will not cover any cosmetic because that's elective surgery at that point. That's something to consider. Yeah, probably not. But can you get it? You can get it. But will insurance reimburse that? Probably not. Can your orthodontist do double jaw surgery? No, your orthodontist does skeletal deformities, braces, brackets, etc. Oral surgery does. I'm sorry, dental deformities. Skeletal deformities is the bone. That's done by oral surgeons. Orthodontists do dental deformities. The oral surgeon does skeletal deformities, okay? Brandon's wife, yes. Andrew Adamo, thoughts on fluoride? My thoughts are you eating it? Not good. Are you brushing your teeth with it and spitting it out? Great. That's the best form of oral hygiene. Yep, absolutely. Benny, share the live. Thanks, Benny. MB, your school, please. I went to Stony Brook Dental School. Now I'm in residency in Manhattan. I can't, for HIPAA protection and privacy of patients, I can't say what residency program I'm in, but I'm in Manhattan. All right. Charlotte, follow the live creator. Thank you. Kristen, I'm having a Lafort done in the spring. Any recovery tips? A resident is doing mine, so can't ask. You can absolutely ask for recovery tips. What do you mean? Well, Yeah, get your oral fort done, dude. That's really great, Kristen. And I'm wishing, praying for the best outcome, the best procedure, everything, And they generally do outstanding these days. Patients generally do outstanding these days because we prepare for it with VSP, virtual surgical planning, which gets it down to like a millimeter or less precision. It's excellent. So you're going to be just fine. And as far as recovery tips, you should ask your surgeon. But, icing, the big thing with jaw surgery is they're going to move your jaws forward or backward, up, down, change the inclination, if you will, laterally. I would ask about your diet. You'll be okay, but like you're going to want to be on a liquid diet for quite some time. As far as recovery tips, pay attention to the antibiotics and the medications that you need to take to manage pain, swelling, etc. Your diet, icing, exercise, and work, time off. There's a number of things. Talk with them about it, though. Talk with them. Melly, around how many hours of shadowing did you do in undergrad? Around 150. Eagle said they told me if I remove my wisdom teeth, there's more than a 50% chance I will lose taste. Did you ask them? I don't want that to happen. Did you ask them about the coronectomy? Because that's talking about the lower jaw. I don't know about taste, so that's interesting. Just ask them, why not a coronectomy then? MB said it's not. What's not? Eagle said, and a numb face for the rest of my life. You need to ask them what alternative treatments are, such as a coronectomy, and you need to ask them, like, go over the x-ray, like, ask them why that would happen. It might not be a numb face, but your lip, cheek, your teeth on that side, this is all controlled by that's the IAN, or inferior villus nerve, in the mandibular canal. It comes out the mental foramen here, forming the mental nerve at the end. It's not your entire face, but it's over here, okay? So can we do extractions when there's swelling, either intraoral swelling or extraoral? Yeah, you can, but you should consider an IND or incision drainage prior to that extraction, right? You know what I mean? Eagle said, MB, are you OS? Yeah, I'm OS. Brandon's wife, at Eagle, no, you won't. Well, you don't want to say no, you won't. It's just not entirely, not necessarily will happen. Aroni Tony, why did you pick dentistry? Well, I was looking at really medicine or dentistry, and medicine is kind of shot now in the United States. I know a lot of people might not think that. It's a personal opinion. It is. But the quality of life of dentists, although it's decreasing very rapidly in 2024, it is still better than of the average. The average dentist still has a better lifestyle than the average doctor, whether being surgeon or doctor. In dentistry, on average, is still better than in medicine. And I will stand by that. Eagle said they told. Oh, you said that already. Big Dave Lee, what blocks would you do for full maxillary extractions? A PSA, MSA, ASA, and palatal blocks, right? Going especially towards the incisal foramen and especially towards the greater palatine, back on both sides, okay? Like back on the palate near the, the foramina. MB, which school did you graduate from? I graduated undergrad from Stevens Institute of Technology in Hoboken, New Jersey, and then I graduated dental school from Stony. They told me, at Eagle, they told me if I remove my wisdom teeth. Oh, you said this right. Hoden said, is maxillary cant fixed, which resulted from a MARP expander. So I don't think the MARP expander will cause a maxillary cant, but can it be fixed with the maxillary, with the HARP expander? I'm not sure. That's an orthodontic appliance. But yes, we do adjust the cant with a Lafort osteotomy, orthognathic surgery. Mubhem, Maki, number 1 in D3 is crazy, dude. That it's actually ridiculous. And whoever, what was it? Mark McGuire. Who is it? Mark McGuire is like a baseball player, right? He's a home run hitter from a long time ago. MBMB, follow the live creator. Thanks, MBMB. Richard Johnson. Do you guys not pull teeth if the patient is anticoagulated? Well, it depends. Most times in oral surgery, we'll always get the primary doctor's recommendation, medical optimization, right? Or risk stratification, however you want to refer to this situation. But yeah, basically we will send out a note asking for the primary doctor's recommendations. But generally for teeth, we will still, like 2 or 3 teeth, we would just say, keep taking your anticoagulants, even if it's like Eliquis. 2.5, maybe 5. For Eliquis, 10, maybe not. But always send out for their clearance, their recommendation, whoever prescribed that, whether it's the medical doctor or the cardiologist. And yeah, get their recommendations, do what you got to do. And so will we not pull teeth? In oral surgery, and it depends, it's also person dependent, but generally we still will. If we're not going to pull it out, who's going to remove this tooth then that's causing infection or pain then, right? You got to answer that. It's not going to be any other specialty. Who do they refer the teeth to? Because we got to help the patient if it's an infection or an absolutely necessary, like a needed tooth to be removed. All right. I don't know how to. It's an orange heart and then a rainbow flag. Hello, Dr. Gallagher. Hey, friend. Mark McGuire, planning on a 1-year AEGD to do more or both to decide. And that's in line with my plan. Thanks. Yeah, you got it. You got it, dude. Sounds like a good idea. Amanda said, at Mark McGuire, tutor me. That's really funny. That's really funny. Ethan McFarlane, what's up, dude? What's up, Ethan? Finally got to shadow the peri department today. Got to see extraction, bone graft, membrane. Good. Ethan, excellent. Let's see what you think of the oral surgery department next. Let me know. Orange heart, rainbow flag said, doctor, does it hurt to have my wisdom teeth removed? Well, hopefully you're getting local anesthesia to the areas like lidocaine or something, and that will blunt a lot of the pain, prevent it from happening, and that should prevent it. You'll feel pressure, sure, but that should prevent pain from happening. The injections are painful, though. I'm not going to sugarcoat it, but that makes it doable. Edith Mason shared the live. Thanks, Edith. MBMB said, don't become a dentist. That's their opinion. Orange heart, rainbow flag. Oh, yes, it does. Oh, responding to someone else. Mother T said, question, I'm losing my teeth due to my rare blood cancer. I'm also on 2 different types of chemo. I'm sorry to hear that. That's very, very sad to hear that. I'm sorry. But I would say I would consult an oral surgeon to see what you can do. You don't want, you said losing my teeth. So that's a very generalized term. Are they infected? Are you lose? Is there bone loss? Is there what's going on? I would consult your dentist to see what's going on and see what you can do to save them, right, during this challenging time. And I'm gonna say I hope that you get better. I'm gonna hope you get better. Okay, I hope things work out. Melly said, "Can wisdom tooth removal cause TMJ?" No. Very, 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 very rarely will that have anything to do with your TMJ. Wisdom tooth removal? Very rarely. Ross Alex does crossbite. Always require surgery initially, depending on your age and how developed your jaws and dentition are. You'd have to see, but many times, especially in older age, after 18 to 21, it may require surgery. Depends on it. You got to consult. You got to consult an oral surgeon. You could even start at the general dentist and then go to the orthodontist and get your occlusion checked there. Ted CED said, I'm an expanded duty dental 4 years, assistant, thinking about dental school. Any tips? Well, why are you thinking about dental school? What do you want to know? MBME said, at Mark McGuire and the thumbs up finger. Melly, is he reading the chat questions or like different ones? Yeah, I'm reading the chat questions. Joel Cabrera said, did you get an A in OChem? I got an A- in Organic Chemistry 1 and an A in Orgo 2. Yeah, I really enjoyed Organic Chemistry, honestly. It was like a Sudoku, like a moving Sudoku puzzle, if you think about like the reactions and how they interact and whatnot. Mother PT pills on a week, off a week. Told no to crowns and no to bridges. What can you do for what? Hey! I'm told to no to crowns and no to bridges. What can you do? Wait, you didn't finish your sentence. Come on. Mother T, ask that. Joshua's Onic. Where's Frank? Who's Frank? Edith Mason. Oh my God, play for us, please. Oh, one day. Oh man, I'm really behind this. There were a lot of questions asked. I'm sorry about that. Younger Bo said electric or manual toothbrush. Electric. Dude, the electric toothbrush will turn red if you're brushing too hard. That's very important because like growing up, I used a manual toothbrush. I thought brushing harder meant you're cleaning your teeth more. That's not true. It's about the toothpaste, the placement, the whatever motion that a toothbrush does. Get the electric toothbrush. You don't want to brush too hard. You're just pushing your gums down, causing gingival recession, right? You don't want that. That's going to cause sensitivity to your teeth by having cementum exposed. Get an electric toothbrush, use fluoride toothpaste, and just brush your teeth 2 to 3 times a day and floss. MBMB connection recommendation, good GPA. Get the best GPA you can get. My like self, I don't know, thing I did was only A's and B's. I only stuck with A's and B's throughout college, dental school, and I succeeded in that. I only got A's and B's to college and dental school, and thank God. Sometimes it was very difficult. It was a challenge, but sticking with that, I ended up getting into the program, the dental schools, everything it worked. It worked, and it will work for you, I'm sure. Prometheus says, have you watched Shameless? I haven't. I'm a Gallagher. I know Shameless. They have the Gallaghers and whatnot. Didn't give the Gallaghers a good light, right? Joshua's Onic said, have you seen Frank? I've not. That's why you're asking about Frank. It's Frank from Shameless. No, I haven't. User 7584, where'd you get your scrubs? TikTok shop. These garbage bags, these are from the scrub machine in the hospital. Yeah, I'm embarrassed to admit, but these are the garbage ones today. Look at this. I just spilled a little beer. These are the, yeah, see this? Yeah, these are the hospital scrubs. And yep, look at that. It's a large. I wear larges. Some people make fun of me. They think I'm wearing mediums around here. No. Not Emmerlyn said you look like Owen from Grey's Anatomy. I get that so much, dude. I get that so much. That's funny. That's really funny. I'm missing a lot of, yep, you look like Owen from Grey's. Are you OS? Yes, I'm OS. You're not putting any of your body in my mouth. Whoa. Wow. Let's move. Wow. Team, let's keep going. Okay. Ethan Avila, you got Tyson tonight? Oh, dude, wait, is that starting soon? I do have Tyson. I actually do have Tyson. Yeah, I got Tyson down tonight. I don't bet or anything, but to answer your question, I think Tyson's good. So here, let's get into it. So it's Tyson versus whatever his name is, the brother, and who's been really progressing well, honestly, right? He's been training a lot and everything. Jake Paul, right? But it's Mike Tyson, right? But here's the thing. Like, there's a lot of controversy. Like Mike Tyson, I think Mike Tyson, if it's not if this whole fight isn't fake, Mike Tyson's just going to come out. He's going to rock Jake Paul in the face. Jake Paul's going to be down. That's going to be it, because Mike Tyson has that capability. That being said, Mike Tyson's doing this for promotion. It's an advertisement, right? Let's be honest. And Mike Tyson has like a marijuana company or something. Didn't they say someone told me, or I read somewhere on Twitter, that Mike Tyson's going to rip one of his products, right? He's going to smoke one of his products before going out. Hopefully that's not true, because I want to see a real fight. He's going to go out there. He's going to be super mellowed out if he does that. And he's not going to come out and rock him in the face. And that's how you know it's going to be fake, if they're doing like 5 rounds. No, this is Mike Tyson for some wimpy dude. No, he's not a wimpy dude. He's not a wimpy dude. He's trained. He's actually extremely skilled. But it's Mike Tyson. That's my point. Mike Tyson rocks him in the jaw. That's going to be it, but it's not going to happen. I think it's going to be fake. I think it's going to be like 5-6 rounds. They're going to get tired. Mike Tyson's 60 years old. He's going to come out ripping a pre-roll. He's going to go and try and fight a few rounds. He's going to get tired. He's going to be huffing puffing. Jake Paul is going to be milking the juice here. He's going to be cashing it out. All right, anyway. Yeshua's Anik, successful Gallagher. No, we're getting there. User 758. I'm sorry. What are you sorry for? MBMB 500K in debt. What do you mean? You? What? ISAA. How long do I need to study for the DAT? I did a month and a half after I graduated undergrad. I did a month and a half. But the PAT portion, I put in like the 2 to 3 weeks of winter break that I had that year. 2016. And so I learned the PAT portion, because all the other portions you learn in undergrad, more or less, right? So that I figured after graduating, it would just be a review. So I learned the PAT over winter break, started studying for all the other sections. It took about a month and a half. I would recommend taking more. Take a solid 3 months and go all in on studying to get that score. Mother T, please answer question on chemo and teeth replacement. You need to see an oral surgeon for a proper recommendation and consultation, right? It depends on your teeth. It depends on, your dental status is very important. It also depends on how long you're going to be on chemo, what chemo you're going to be on. How far out are you going to start chemo after extractions or during extraction? There's so much that goes into this. You see what I mean? ISA, how long do I need to study? Predental. Luke, what's up, dude? Luke, my man. Did you do anything besides your jobs during your gap year? Yeah, I read a lot. I did stocks, music produced. I did a lot of basketball and catching up with friends and family and traveling a little bit. Yeah. Oh, yeah. I did a lot during my gap year. And you should too, Luke. You're super smart and hardworking. I don't think you're going to need a gap year. But if you do, dude, don't back down on it. It's your one chance to kind of get to see the real world in between college and dental school before you go back. And I think that's a really important nurturing element for your become an adult, be going to dental school. It's going to really give you a better understanding of life and the world before starting your dental school experience and then residency right after that, right? So it's very important. All right, a couple more questions. Now I gotta go. I gotta go eat dinner. MBMB ISA at ISA don't do dentistry. I mean, I'm not recommending that. You don't have to say it that way, but what you got to support what you're saying if you're going to recommend it, right? Ashlay said, I was one of your patients almost 4 years ago. Were you really? In what way? For what? Where? And where? Where were you? Was that at Stony Brook Dental School? ISAA, MB, MBY. Good question. Ramez, is there a difference between DMD and DDS? Why would schools have different? Oops, sorry. Why would school have different titles? There's really, it's the same degree. It's the same degree for dentistry. DMD was created by Harvard Dental School at somewhere in like the late 1800s. They wanted to be different and be more sophisticated and better than everyone else, like they always do at Harvard. And I love their residents. You know, many of my friends here in residency are from Harvard. Actually, one of them is like literally one of the smartest people I ever met. He got a 99 on the CBSE. That's the highest score you can get on the CBSE. He went to medical school. He's here at the 6-year program and they spend 2 years in medical school in the 6-year program. That's not me. I'm the 4-year program. We don't do medical school. And in the medical school, he was valedictorian. So he was number one in the class, which is hilarious because he's an oral surgery resident. You could imagine there were a lot of pissed people because they're like, I studied my ass off, yada yada. I'm smart. Like I want to do ortho specialty and I need a match. And an oral surgery resident who's already matched and like doing his thing is valedictorian number one in the class. I think that's hilarious. And I'm so happy and proud. I'm happy for him and proud of him. And he had a rough year, but he's an outstanding resident. Yeah, dude, I look up to him. He might not even know it, but anyway, KDS2107, can a wisdom tooth be used? Couple more minutes. I gotta go get dinner. They might be at a sushi now at Fairway. Oh, I gotta go. All right, 3 more questions. Can a wisdom tooth be used as an anchor for bridge? If there's a lot of mesial drift on it, maybe, but generally it's not recommended to be used as that. MBMB said I said disappointed in too many aspects. That's fair. MBMB said education is very expensive. True, it is. ISAA said MBMB, you make so sense, disappointed in what you not do know me. What? Bosh, thanks for answering me. Yeah, you got it, Bosh. Also, work at Mid-Atlantic level 1. Dude, so you're at a level 1 hospital. You're busy. It's like an if you know thing. Dude, just you do your thing. Find the best in every day. That's what I would say. You know, you got to follow your happiness, and level 1 trauma center is going to be a lot. And it's like an if you know situation, right? You're overworked, you're underpaid, and it's like a system designed where you're like fighting your colleagues. And I hate that about it. NBME said at ISAA, good luck with your path. Awesome. ISAA said at NBME, you shouldn't do dentistry, buddy. How about that? All right. Wow. You guys are hilarious. This is very dramatic. Brandon said, what do you think about Montefiore residency program? Outstanding. One of the top 6, I would say, in the Northeast. I would say that very firmly. Yep. Bull said, do most people who want a 4-year residency do a non-cat? So, and it's really changed in the last 6 to 8 years, like really changed, where previously, nope, there weren't many non-cat spots. And also the 4 years would usually just go into 4 years. And I don't know enough, but I still think that the 4 years just go into 4 years, but there are a tremendous amount of residents and residency programs that take 4 years that came from their non-cat position. Like it's like a tryout. You have your non-CAD or 2 or 3 come in for a year, and the best one you pick for your non-CAD, your 4-year spot. And it does make sense. It really does. So on average, I don't know. Great question. Do most people who want a 4-year residency do an BME at Isa trying to get out? Don said, huh? Brandon, what do you think of Montefiore? I let you know. Brandon, awesome residency. And do you think dentistry is oversaturated? In certain areas, it's very saturated. Is it oversaturated? Depending on how you will be as a dentist, yes or no. It's subjective. It's also very particular. It's very case sensitive. Bull said, do most people want a 4-year residency? Do not. MBMB said, NYU. Ryan said, do you often work with craniofacial plastic residents? Not very often. How is it working with different specialists? In the Northeast, it's very political. There's a lot of butting heads, I will say that, which is disappointing and frustrating to see and sometimes be a part of. I do not want to be. I'm an over communicator. In fact, I had a conversation with the team this week. I like to over communicate. Sure, you could say it's annoying, but I think it's necessary in the field of healthcare. You need to over communicate things to prevent problems and issues from happening, right? So I will continue to over communicate, even though it might be called annoying or whatever. We need to over communicate problems and solutions, because in healthcare, when the patient's involved, that's the only 2 focuses we should have in our mind every single day. That was not a speech, but I feel like it kind of came out that way. Anyway, all right, friends, I'm signing off. I have to go get my dinner. I love you guys. This is TikTok number 39. Man, an hour and 15 seconds. I got to go get dinner. All right, I got to go. Guys, thank you so much. TikTok number 39, the top 3 listeners. This is a long one, so whoever stayed in, you guys are the OGs. And I love you guys. I really do. That's why I'm giving you guys a shout out in the comment section. A podcast that's Apple Music, Spotify, YouTube channel. I'm going to put you guys out there. I'm going to do top 5. All right, guys. I love you. You have a good night. Happy Friday. Thanks for coming on. And we will, I'll be back on in a week. All right. Good night.